My name is Tyler Pack, and I will be discussing tuberculosis. Tuberculosis is caused by Mycobacterium tuberculosis. Usually targets the lungs, but can also affect any parts of the body, such as the brain or the kidneys. There are two different stages of tuberculosis, the latent stage and the active stage. I'll be talking about in other slides. Tuberculosis can be fatal. In 2015, the CDC reported that 9,557 cases of tuberculosis were reported in the United States, 10 million worldwide, and 1.8 million deaths worldwide. Not everyone infected with tuberculosis bacteria becomes sick. This results in two different stages. The latent stage shows no symptoms. The tuberculosis bacteria cannot be spread in the latent stage, but the skin test or the TB blood test do show positive for the latent period. Most people with latent tuberculosis infection do not actually develop the tuberculosis disease. It remains inactive for possibly their entire lifetime. For those with a weakened immune system, however, the bacteria does become active, causing the tuberculosis disease, but this only results in about 5 to 10%. For the active stage of tuberculosis, the bacteria is active and multiplying in the body. The bacteria can be spread during this stage, and persistent symptoms do occur. I'll be talking about the symptoms later also. Modes of transmission for tuberculosis include exposure in the air. A person that's infected with the tuberculosis can sneeze or cough, can speak or even sing, and the active form of tuberculosis is transmitted in the air. The bacteria can remain in the air for several hours, and being in contact with someone who's exposed increases your chances being in daily contact with them, breathing in the air that they're exposing the bacteria in. Signs and symptoms are dependent on where the tuberculosis bacteria are growing in the body. The most common is in the lungs. The symptoms include coughing, severe cough actually, that lasts more than 3 weeks, severe chest pain, coughing up blood and sputum. Symptoms of tuberculosis can result from being in different parts of the body. These are not as common, but include weakness, fatigue, weight loss, chills, and fever. Some populations are at higher risk for developing tuberculosis, such as those who have recently been infected with tuberculosis, have been in close contact with a person infected with tuberculosis, maybe live or work around people who are at high risk, such as hospitals, maybe homeless shelters, or actually live with someone that have HIV. Other populations that are at high risk include those with medical conditions that weaken the immune system. And of course, babies and young children have naturally weak immune systems. Also, people with HIV, those who abuse substances, have diabetes. The leading killer of tuberculosis is the leading killer for those who are infected with HIV. There is a vaccine for tuberculosis, Bacille Calmette-Guerin. It's named after the French scientists who developed it. The vaccine is not widely used in the United States, but is given to infants and small children in other countries where tuberculosis is common. The setback for BGC is that it does not guarantee protection from getting tuberculosis. There are treatment options. Drug treatment is usually for 6 to 9 months. 10 drugs are currently approved in the United States by the FDA. There are first-line agents that form the core of the treatment: isoniazides, rifampin, ethambutol, pyrazanamide. Not taking the full course of treatment can allow antibiotic-resistant strains of bacteria to develop. If not treated, tuberculosis can cause severe damage, such as pockets or cavities that form in the lungs. These damaged areas can cause bleeding and become infected with other bacteria and form pockets of pus, such as abscesses. It can cause a hole to form between nearby airways in the lungs, and it can cause difficulty breathing due to blocked airways. Here are pictures of lungs that are infected with tuberculosis. The photo of on the left are lungs that actually display these pockets that I talked about in the previous slide with excess bleeding. The picture on the right is just an x-ray of lungs that are infected by tuberculosis disease. Tuberculosis is becoming increasingly antibiotic resistant. This poses a threat to people worldwide.